I'm Dr. Sally Foote, a veterinarian and behaviorist with over 30 years of veterinary practice experience. I'm also a low-stress veterinary care expert and educator doing speaking, writing, and I provide veterinary behavior consultation to clients with a vet-to-vet consult included. So this past, seeing some people get on, it's wonderful. This past weekend, I was just in Michigan, in Grand Rapids, for the Michigan State Veterinary Medical Association Convention Conference, and I was presenting. And one of the topics that I presented was getting your client to be a part of the care equation. And I've written a little bit about this. I did a previous Facebook post about this a while ago. And really, as I, in the presentation, taking some question and answers, and I also recently had posted on one of my veterinary practice forums, asking, what do you guys sense is the resistance coming from clients when we give pre-exam medications, we prescribe them, we send them home with them, but the client may not give it to this animal, or they only give half the dose, or they don't give it correctly, or they're showing resistance to giving it. So what's behind what I call the drug-resistant client? Now, this could go on long, but here's the first things I wanted to at least identify the why. Why do our clients resist? And I'm speaking about for both the dog and the cat. I'm a dog-cat veterinarian, so I'm going to talk about both the dog and the cat. So the first one is, sorry for backward, but anyway, they're too sedate. Okay, we know they're not too sedate because they're coming in the door, or they're being carried in the carrier, and as soon as we get them out, we may allow them out, we start touching them, we start handling them, we start the examination. That's an adrenaline rush, a little stimulus on the animal, plus even arriving and knowing that they're there. Their adrenaline is rising, and none of these drugs reverses or stops the adrenaline rise. It slows it down, but they get that adrenaline effect once they're with us. But with the client witnesses at home, might be, after they gave the medication, they're driving to, our practices, this dog or this cat is snoozing away, really asleep, and the client may worry, be like, oh, wow, he's really out of it. Or, fine, they're snoozing away. Client may see, if we have a client in the exam room, which I'm always in favor of, because now it speeds communication, it builds trust, and the client can see what's really happening. In other words, that the animal is different at the veterinary clinic than they are at home. But then when they take the animal at home, they're sleeping it off for hours. Okay, so the client doesn't like that. For a 20-minute appointment, he's got to be zonked out for 4 hours, and they may worry about him being kind of really sedated at home. Okay, so that's one of the resistances that clients do get. Number two, maybe they want everything to be just very natural, very natural. This is an animal. We can't tell him how weird he's going to feel. On alprazolam, some people who do a lot of people take a lot of the same drugs we're prescribing: trazodone, alprazolam, Valium, clonidine. And I know, and I can remember and rationalize to myself why or how I feel on this drug. Or another friend of mine might say to me, oh, you take that alprazolam, you may not remember everything that kind of went on around you. You get this amnesia effect. So I can be prepared by a trusted person, but we can't tell our pets what to expect. And so oftentimes clients kind of fear oh, I hate the thought that he may be feeling all woozy and weird. Or it may be, well, he's a dog or she's a cat and she's going to try to bite you. That's just how it is. Okay, all right. I'm not saying it's a good thing. I'm saying this is the rationale for the clients, okay? And then lastly, worry about, is this going to be safe for him or not? Okay, because it's out of the natural state for the pet. Okay, the third one, and this is the one we see sometimes as we are working to do these victory visits and low stress, let's practice cooperative care and husbandry at home. And that is, they're good at home. Okay, in other words, we've been doing the training at home to handle their feet. He's really good about it, so now let's go to the vet. And we can do it at the vet. No, you can't. because we didn't get it practiced at the vet yet, okay? But this is the reason why the client says, I want to try this without the drugs. He's been doing so good at home for getting in the carrier, letting me clip his nails, or touching like you showed me with the pen on his back. And that is all good to do, yet we have not added in all the other triggers of being in the veterinary environment. And when you add on those other triggers, if they have not been also counter-conditioned, positively conditioned to, or are they able to positively condition to being inside the veterinary clinic on that examination table, or how the staff is handling, etc., then that's why this is not enough. Being good at home is not enough. Okay, so this is why the client is resisting, why they may be coming in and saying, I wanted to do it today without the meds, and you're expecting them to medicate it. Okay, so now what are you going to do when that client does show up and they're not medicated? Let me erase this real quick. Okay, sorry, it's a little damp cloth. So now let's get over here to the what. What are you going to do in that moment, right? All right, number one, don't assume, do not assume the client gave him meds. Don't, just don't. Because there's enough of these drug-resistant clients. You might start handling and the animal's getting a little touchy, you know, etc. And you're like, wow, maybe this drug is not working so well. No, we got to know before going into it what we're walking into, right? So what to do, always verify. All right, what is that? Old saying, trust but verify. Verify the dose they gave and when. And if they say, well, I forgot, I got busy, or, you know, he was so drunk last time for 6 hours. I just thought I wanted to try it this time without it. And they may be saying, and that's very sincere. Okay, so do not judge them. What you do is you do not judge. Only take this as a matter of fact. Okay, take it as a matter of fact, not as a, oh my gosh, you think I can be a magic maker here. No, please. Let's remove all the emotion out of this moment, okay? At least our own. I mean, they're emotional, but let's get our own out of here. And just be objective. Okay, so he's not medicated. This is what we need to take care of today. Vaccinations, heartworm test, check anal glands, examineers. Without the help of the medication, we are going to do today, we're going to start with, and we're going to try. The word try. So what word do you say? T-R-Y, try. We're not going to guarantee we're going to be able to get everything done, right? Because we lost our tool. We lost medication as a very important tool for a safer and less anxious examination. So we say to the client, okay, fine. Say we don't have our tool of medication to help him and help us. So we will try to do what is most important for his health and welfare on this list. And with each thing we do, we're going to continuously assess whether or not he is calm enough to accept the next thing needed. All right? So you are setting up right there an expectation that you will not get everything done. This is really important. You know, make it very, without yelling at them, okay? You just said, okay. And so we're going to try, and so then we are, basically what you're doing is you're triaging. Now then, third thing that you're going to make clear to them is, do I have my, can we do this? Sorry. Can we do care? Okay, and in that moment right there, can we do care? Sorry, I'm standing in front of my words. Can we do care? Okay, that is going to be based on, I'm going to come over here now. Number one, do you have, oh my gosh, spelling, your team with skill? Okay, what does that mean? You took away my tool of medication that helps to decrease anxiety, aggression, escalation, which means then, because I can't remove all the triggers, right? which means then the staff I have in this moment right now, being the doctor, the assistant, or the technician, do they have a higher skill, the higher skills to read body language, know the low stress handling, techniques, how to strip away the environment right then within the next 30 seconds so that you can stay on schedule and go forward with the care while minimizing the time of this animal in that space. If this is a day someone, without telling me, arrives and says, I decided not to give the trazodone today, and I have a brand new graduate veterinarian who has only just recently maybe taken their fear-free certification, if even that, has never worked in a veterinary practice before, with a technician or assistant with 1 year of experience, I want that DVM to say, no, we can't do you today. Why? Because without the help of you, without this tool, we don't have our highly skilled team here. I'm not skilled enough. That is like asking this doctor, if they took an animal off of, say, heart medication or pain relief medication that would help to facilitate ease in doing a surgery. Now you want this new grad to do a surgery and have it be more difficult? Now we want maybe an increased anesthetic. No. That we empower our staff and we help our staff educate to know, am I an A team, like an A+? Am I a B+? What level is my skill, and now will it match? Especially if this, and as we see this more in the dogs, they're resistant to walk into the exam room. They're resistant to walk into the building. They're walking, and the dog does the stop, and he won't come in. He's avoiding. If he's doing all those avoidance behaviors, right there say, listen, he's already at, and this is where you point to that ladder of aggression. Have those, the first of my top 5 low stress handling techniques, remember, is that canine ladder of aggression, the body language of fear, is posted in every exam room, in every treatment area, in the waiting room. So when this dog is ducking and backing away, that tech and doctor are saying, he's not having it today. He's already up to here because he doesn't have his meds. And then in that case, okay, so now that obviously shows a higher level of skill, but even if they're like, I don't know how to handle this guy with the skill, this is where then secondly, do we have a space that we can immediately care for him, okay? And client, you are now going to have to do more things right now in this appointment. Client, I need you to be willing to maybe go outside and let's stand against the side of the building while it's 40 degrees outside in the rain. Your dog is fine out there, but not fine in here. Let's go outside right now. He needs a 3-year rabies vaccine. We're going to do it in the front yard. We're going to do it behind the dumpster, behind the building where the traffic's not going by, okay? And client, you're going to have to be happy standing outside like this with your dog, maybe feeding him with the bowl, okay, because I need you to keep him really busy while my tech and I can do this shot. We're going to part ways. And that's all that happens today, okay? Because this is where we can be safe. So do you have the space? And secondly, the client is going to have to be more involved, especially if they're coming in unmedicated. The client has to witness the care. Now, if you don't want them to, if you take them back to the treatment room, you have to put them on FaceTime and tell the client, you got to watch this. And you will be able to see your client or not. Because the client has to see the difference when the pet is medicated, what you can do and what you cannot do without that medication. We have to be transparent in our care for our clients to help understand this. Now, let's say you got your A team and we got them outside and things are better, and the client says, yeah, I want to do it this way. Yes, I do. Okay, fine then. This will become the new way of how we do things. But even if you're outside, though, and the animal's still showing agitation, do not, you want to say, like, well, this is all we're doing today. He really needs the meds, and this is why. Now, this then leads me to the third point, which is you have to call it quits. You have to stop everything you're doing and say, we cannot do this today. If especially that dog shows any level of repeatedly ducking away or going to stare, because remember, on that ladder of aggression is starting at stare. In cats, if the cat goes up to hiding, swatting at all, any swat, you have to stop. Because they will go up to bite. And there's a big difference in the animal who is bitten versus not bitten. They learn to bite. They learn I have to bite to make it stop. That is why do not push through. Do not keep trying. Do not keep touching them. That is just too much stimulus on them. Plus the client is seeing like, well, I guess it must be okay because you keep on trying to do it. we are making it worse in that moment. Okay, if we keep on trying to be happy with the client, or just trying to refigure this out. Now, some of my little statements I find to be helpful to clients if they say, well, why can't you just do it? I say, because it's like asking me to do surgery without anesthesia. Or, yes, 70 years ago, when we didn't have as many good anesthetic agents, there were times an animal was not put under any kind of drug or product to extract a really badly infected tooth. They just yanked it out. We never do that today because we have an advancement in medical knowledge, safe use of drugs, and for the welfare of the animal. And this is where we are at in veterinary behavior now. Low stress veterinary care and uniting this. And so this is a comparative to the client. To your dog, he's so scared, he can't help it. And that's like asking me to do surgery without anesthesia. That's like asking me to not give him pain relief medication before we're going to put him through going on an underwater treadmill in a big physical therapy session. How fair would that be? Or taking x-rays on what we know is maybe has been a partially injured or torn cruciate ligament, and now we got to take the x-ray. We purposefully do not give him medication. That is harmful to them, it is hurtful to him, and he learns it's painful and horrible to come to me, in which case it makes his behavior worse. Now for that, that other situation I talked about, and I think clients really are like, they don't realize the difference between learning at home how to tolerate touch, handling, etc., and learning that at the veterinary clinic. It's all about, you might be able to do it at home, but you can't do it at the clinic because they have not coming up to the parking lot on Sunday afternoon and getting their dinner to be used to a calm arrival. They have not come into the clinic, maybe at lunch hour, when you don't have a lot of appointments, if you are still open for people to coming into the lobby. Coming into the lobby, staff throws some food at them and getting on the scale, getting off and just going home. Okay, these happy pet visits that get them less agitated about the veterinary office. And so that's what they have to do. It will always require more homework for the client, and that this practice at home, you got to come here, show me you're doing it too, practice at the vet clinic before we're really going to go drug-free, okay? Explaining to the client, yes, he will be sleepy for 6 hours, so I get a safe 20 minutes with him. But he can't help it. He needs this medication like I need glasses to be able to see correctly. I mean, yes, make these analogies. That is sometimes helpful. Now, if you've got a client, no matter what you say and no matter what you do, is not going to give drug, then you go to, is this a client? Now, is this a client I want to provide care for? I feel it's very confrontational if we use the word fire, because you may not want to provide the direct physical examination of that care, yet you would be willing to provide veterinary advice or care for their other animals except for this one. Okay? So in that case, I tend to use the words, if you do not give this med and we do not have this A+ team, he has not learned how to be happier at the vet clinic, and we have done all that we can while preventing him from escalating. He needs the drug, and if you will not get it, then I cannot provide care for this pet. That's what I would say. And I walk out. It's not negotiable. Okay? It's not negotiable. Oftentimes clients will then kind of see the light, and especially when you emphasize, listen, with the help of the meds, as he is doing better here, then we can wean down the drugs. I think that's the other thing. Clients need to see hope, that you aren't always going to reach for the drug first, or aren't automatically going to always drug. That they need to see hope that the animal can come down and be in that kind of natural state. But what that requires then is that you, client, are going to do the homework for coming here after hours, make sure he's happy in the car ride arrival. You're going to come here on the lunch hour, you're going to show me those videos. You can be happy wearing the muzzle. The cat's going to be happy wrapped in the towel. The cat's going to be happy in the carrier. Send me videos driving to the bank with your cat in the carrier, and he's happy in the carrier. Okay, then that will help me to feel more confident and advising for a slightly lower dose. And we go through and then tell the client to expect. It's going to be a titration. We don't go from full dose of drug to no drug. That's like falling off the cliff. He's going to have a full dose of drugs, maybe 25% lower, and then another 25% lower for the next visit, and another 25% lower, and then maybe we use a bridging supplement. Okay, a lot of these drug-resistant clients are often accepting of a supplement, which can also be helpful. And the supplements can be double dose as a way to bridge. If we won't use drug, we'll use supplement, or even as they're weaning down off the drug, to at least have a supplement for some kind of anxiety and aggression support. So here, sorry it's backwards. Got to figure out these new settings on Facebook, sorry. But anyway, you know, think of those things. Let's have some empathy for the client that they're refusing this because they don't want to see their pet drugged for hours. I wouldn't probably either, for just a short procedure at the vet clinic. So then therefore, prep the client for that expectation and how we can decrease the dose of the drug if you do more of the homework too. Let's work together on this, okay? Number 2, the natural state. The natural state's an often only wonderful, you know, thing to want to achieve, yet it's not realistic when it's natural for them to try to bite if they feel this threatened. And if we need to clean an infected ear, look at a cut on the foot, or give an injection, you know, like vaccination, and that prick of the needle is hypersensitive for them, they need the help of the drug to not turn and bite because it's a natural behavior for them, and obviously it's going to injure me, and I can't be injured. I have to take care of other animals, and I don't want them to learn to bite me. And then lastly, well, he's good at home, why don't he be good at the vet? The emphasis of he has to learn in every environment he's going to be in before we can, to see, can he also counter condition to all these other triggers at the vet that aren't at home, to see how well he can do before just stopping the meds. We can wean down while still in this place, okay? So thank you very much. Watch for this posted on my YouTube channel. You can share it with other people. I will be speaking in California at the SAGE Symposium, October 23rd. Then I will have a booth at the Illinois State Veterinary Medical Association meeting coming up on the first weekend of November up in Oak Brook, Illinois. Subscribe to my YouTube channel and to my newsletter where I'm going to keep these things posted up. And have a great day. Bye-bye.